Welcome, everybody, to our webinar today on maximizing orthopedic practice performance from data to insights. My name is Scott Everett. I'm the Vice President of Healthcare Solutions with Practical Data Solutions, and I'm glad to be joined by our CEO today, Russell Hendrickson. Welcome, Russell.
Welcome. Good day, everyone. Thanks so much for joining us. If you're not familiar with Practical Data Solutions, we focus on delivering healthcare analytics and reporting solutions in three key areas: operational analytics, clinical analytics, and financial analytics. And it's great to have you join us today. We're going to cover some interesting objectives in today's webinar. We're going to talk about the patient experience. We're going to focus on both operational and quality improvements. We're going to talk about the need and the critical role of timely and accurate billing, ways to negotiate better contracts, and ultimately going to break down some of the critical KPIs that orthopedic practices need that are different than what you might find in sort of your typical primary care group.
Today, practices are really looking to become more data-driven. And so when we talk about data to insights, that's what what we're talking about, is taking the data and utilizing it to make better decisions. We're talking about taking the data to uncover opportunities that are out there. And of course, utilizing insights from the data that pop up in order to improve performance and then make that a continuous process so that we're always focusing on the data, that we're discussing it in meetings, and it becomes a key focus of our decision and goal setting process.
Yeah, Scott, and you use the word data driven. We hear that word all the time, and there's so much analytics out there. Every single EHR has packaged analytics, there's tools. Just about every ancillary application that's used in healthcare has different sort of query tools or reporting tools. But there's a reason why orthopedic groups in particular need, more than just what's available in those standard reporting tools. And it really comes down to the fact that there's a lot of nuances that make orthopedics, much more challenging to deliver to. And there's just a number of different ways that metrics have to be analyzed if we're really going to understand what's going on with our data and try to improve performance. So let's take a look at an example of a dashboard that you might want to use, or a page of some of the metrics you might want to see in an orthopedic practice.
Yeah, see, this goes beyond what you might see just in canned billing reports. Sure, you may get the visit reports and things like that, but as an orthopedic practice, it may be necessary to really break out the location of your surgeries. How many are being performed in your ambulatory surgical center? How many are being performed in the hospital? You may want to look at the different areas of the body that you're treating. How much are you doing with hips, knees, shoulders, ankles, etc.? And you may want to look at the different procedures that you're doing that go well beyond just E&M codes, office visits, and those types of coding curves that come through typical canned reports.
And so that's what we're going to do in today's webinar. We're going to break down a number of these different metrics. We're going to talk about the tools and the technology. And so, really when we talk about what does it take to improve orthopedic practice performance, we have to think about what are the cornerstones? How are we going to break down these different areas? And so for today's webinars, we categorize what we call the cornerstones of orthopedic performance into really 5 key areas. We're going to talk about the patient experience. We're going to talk about operations. We're going to talk about streamlining finance and our revenue cycle metrics. Of course, we have to touch on clinical quality. And then one of the key areas that's often overlooked is what's going on with our employees and how engaged are they? And so these are the key areas that we're dig in today. So with that, Scott, let's dig right into patient experience.
Patient experience is something that we're actually finding a lot of people that we work with are focusing on right now, because when you focus on the good of the patient, then everything really kind of falls into place. And when we talk about patient experience, we're not just talking about the quality that they receive and did they receive appropriate care. We're also talking about, things like customer service. How were they treated? What are the things that impact their perception? And so in order to really understand that, we've got to dig into the patient satisfaction scores, and we have to go beyond just, were they satisfied? We really need to figure out what they were satisfied with and what are areas that we're struggling in and maybe need to address.
Yeah, and so most organizations, actually all organizations I'm aware of, are sending out surveys for a number of different reasons and looking at the data. But where we need to go beyond, how do we use data to drive insights, right? So if we just take sort of that off-the-shelf canned reporting that might come with your patient satisfaction tools, it's not going to share appropriately. One, it's not really designed to communicate effectively with the physician or the care teams. But two, by taking that data and reformatting it, And what you're looking at here is a visual dashboard that has redesigned how we look at the data. We've moved the two key scores front and center. Would the patient recommend the physician, and would the patient recommend the group? And right away, we can quickly see they're happy with their physician, not so happy with the group. The second thing we've done is then we've broken down the various questions, and we've restated where that midpoint is. And we've said if we're below 80%, we have challenges, right? And so by using this yellow highlight, we can quickly see that they're not real happy with how the practice is communicating by telephone or setting up appointments or even being courteous. So we can very quickly see these yellow shaded regions highlighting and communicating where there are performance improvements.
Yeah, so when we look at things like that, it's really important to understand where we're struggling in these areas. And I like what you did by saying, if we're not at an 80% level, we're not doing very well. Some of the other things that we need to think about is it's not just these patient satisfaction scores that we're getting back and we're sending out. It's really important to look around at the online reviews that we're seeing on places like Yelp and Google and Find a Doc and things like that, and really understand the perceptions people are saying about us and work to correct and manage those as best we can. One of the things that we find more and more as we look at patient experience is a big dissatisfier is when patients don't really have appropriate expectations regarding patient billing. What is their expectation going to be for the patient responsibility on the back end? What are they going to be responsible for financially? They don't want to be surprised when it comes through, and that can really be a big dissatisfier. Even if they get great care and even if the staff is great, if they're on the hook for more financially than they were expecting to be, then that's a big problem usually. And then of course, another key driver that we see is how long are they waiting in the clinic? That's definitely something that really drives the perception of the care that they're receiving.
Yeah, and so many organizations, again, there've been study after study about wait times, although I don't see a lot of recent information on this. And in part, one of the challenges is getting the data. But most of the better EHRs today have the ability to track wait times. But of course, it may take, doing something like being able to break down and look closer at that wait time data to start to understand how is the patient being scheduled versus when were they checked into the room versus how much time was actually seen by the provider. And we're going to talk more about scheduling optimization when we start to analyze how much time is the patient waiting, but also how much time do we schedule for the physician versus how much time the physician's actually seeing the patients. And we'll talk about that in our next session here when we talk about, operational improvement areas. So the second cornerstone that we want to touch on is operations. And in this area, we're going to focus on scheduling optimization. We're going to talk about measuring patient KPIs. We're going to understand the different mix of procedures and how that also impacts many of the different ancillary services we might have in an orthopedic practice.
Russell, you just hit on it a minute ago where you talked about scheduling optimization, which is really a key part of the operational KPIs and the cornerstone that we're looking at right there. In addition to that, we're going to talk about patient KPIs, procedure mix. That's really important for orthopedic practices, as well as reporting on what we're receiving from the ancillary services.
Yeah, and there's such a nice, dovetail between we were just talking about how patients view the patient experience, but the number one thing that patients, you see as sort of the biggest complaint or challenge to organizations is patients are never happy about how long it takes to get an appointment. And so if we're going to focus in on patient experience, but then streamline operations, we want to be looking at things like appointment lag, canceled no-shows, bumps, session availability, and scheduling utilization. There's just so much areas here, both, from a patient experience side, but ultimately, having good data and being able to understand what's going on is going to allow us to then optimize our physician utilization and our care team utilization, which will also drive more revenue. So these two just go hand in hand. Scott, walk us through this dashboard here. What are we
Yeah,
looking at?
so this is a great way to look at scheduling that's out there. And one of the things that I always start with is that day of the week session analysis, where I'm looking at my AM and PM sessions and seeing what is my really true capacity, how much can we do, and why are we not at full capacity if we're struggling to get patients in. Is it a staffing issue? Is it a space issue? And then, of course, looking at disconnects between the data where I may see very short third next availables, meaning I could get patients in quickly, but my appointment lags are 2 to 3 weeks long. So there's a reason why I'm not getting these patients in. It's something I need to dig deeper. And the first place I'm going to start is looking at my providers and seeing how well they're utilizing their available templates, how much is booked compared to how much is scheduled within their templates.
Yeah, and so there's just so many different insights that both drive to the efficiency of the organization, ultimately how, effective we are in getting patients in, especially when it comes to orthopedics. I know when I've got a pain or I, broke my hand several months ago, it was critical that I wanted to be seen right away. And if I couldn't be seen in one practice, I wasn't beyond calling another one to say, look, I want treatment right away. So being able to measure and understand what's going on, but then also, making sure we have insight to understand, why is it we have so much capacity maybe on, Fridays, and we've got a little bit Monday afternoons. Maybe patients don't want to be seen during those times. But again, ultimately, what we want to do is try to take this information and cull it out into data insights that we can use. So, ultimately, by having data, being able to slice and dice through that data, being able to look deeper and understand what's going on in our scheduling metrics, we can really start to gain insights to understand and maximize our practice performance. But Scott, we talk about appointments counts, but there's a lot of different ways that patients and patient KPIs need to be measured in orthopedics. And so what's interesting is, certainly we can count patients, we can count patient appointment visits, we can count new patients and established patients. A metric that we've talked about in the past, though, how many new patients coming back, but they're really new returning patients. They're coming back, with a new case or a new diagnosis. So these are some of the things that we want to do. But please talk to what are probably the two most common breakouts of patient KPIs that we would want to see in orthopedics.
Yeah, it's interesting because all of these are defined a little bit differently by everybody else, ranging from fairly simple counts and encounters of, here's who was scheduled and here's who came in. But sometimes you want to look at, patient provider mixes and understand, patient provider data service is an encounter. And if they see two providers in that day, that may be a couple of encounters that we're seeing, which may be different than what we're seeing in a visit count. And of course, in orthopedics, it's really important to understand surgical cases where it's not just the visit that we're seeing initially, but we're talking about the entire episode of care that comes from a specific diagnosis or procedure mix that's out there to consider it being a case, so to speak.
Yeah, and so there's not, what's the right definition is really how are you measuring things? How are you managing and how do you need to be able to track? So I go back to, your data insights are going to vary by organization. Again, if we were to, take some of those key metrics, we may want to just track visits. We may want to track visits by different ancillary services, whether they're PT visits or patients that are using, radiology, versus some of the other services. We may want to track, usage in our ASC, or any work we're doing within the hospital versus in the clinic and outpatient. And of course, we certainly want to project, future scheduled surgeries to get a feel for both volume and utilization, but also it's a great way to lead into, how we're looking at revenue. So we've talked a little bit about, seeing more patients, and when we think about strengthening the bottom line, right? We've just talked about that second pillar, which is, operations, being able to see more patients and provide more access and using scheduling data to improve our patient access. But, two of the other key areas that really fall to both the financial performance, which will ultimately strengthen our ability to deliver our services and be more effective. We also have, how do we improve reimbursement and get paid faster? And that leads us into our third cornerstone, which is finance, right? Where we're going to talk about things like the revenue cycle, payer contracting, payment lags, of course, denials, the biggest opportunity to improve performance and collect more money, and then even looking at things like costs and margins for our different services and service lines.
Yeah, the revenue cycle, we talked a little bit before about patient billing and trying to understand their perspectives on that and how it can actually drive the patient experience. But really looking at everything involving our revenue cycle is something that we need in order to make sure that we're being financially viable. We need to understand charges, payments, adjustments. We need to understand what's coming through, but we really need to understand the entirety of the revenue cycle. So we need to look at things like charges, payments, and adjustments and the cash that's coming through every single month. We need to understand our management of our accounts receivable. We need to understand, payer mix, charge lags, how quickly we're getting paid. And then, of course, denials, as you talked about, is a big thing. And so we need to make sure that we have reporting that's appropriate to us, that gives us a very strong picture of the entirety of our revenue cycle.
Yeah, and there's a couple things on this dashboard that I really like. One, we're looking at sort of monthly patient volumes, which goes back to looking at patient KPIs, but also at the bottom left corner, this dashboard, right? We have would the patient recommend the group? So keeping in mind, as much as our drive is and focus is to improving financial performance, we really want to make sure that we've got that patient satisfaction levels up, because if we don't, obviously we may have patients that aren't coming back. One of the things though, Scott, and we talk about this a lot at PDS that is absent on this revenue cycle dashboard is RVUs. And many orthopedic practices, especially given the nature of the specialties, they run that kind of eat what you kill model. So they're more interested in collections and reimbursement in total. But why are RVUs important, and why might we want to have unique or custom calculated RVUs versus what comes off the shelf in our billing system?
Yeah, RVUs really are important, even if you're not utilizing them to measure physician productivity or utilizing them for compensation calculations. You're getting reimbursed based upon the RVUs. That's how you're getting paid by your payers, even if it's not specifically spelled out in the contract. It's really helpful to understand, the different RVUs that are out there. You look at the modifier adjustments, and you may need to have special calculations out there if you have specific codes that may not be listed in the CPT tables that are out there, that are unlisted codes or pseudo codes or tertiary services that you provide that are unique, and understanding volumes and understanding the effort that's going into that from the standpoint of your providers. Really looking at RVU calculations can be a key in making sure that you're calculating them appropriately.
Yeah, and Scott, you mentioned it, head on. You're getting paid on RVUs, right? So some of the key revenue cycle financial areas that you want to be looking at certainly would be, how are we getting paid? Are we getting underpaid to our contracts? We may want to look at our reimbursed per work RVU as a way to compare our contracts. Things like, how is Blue Shield or Aetna, comparing? We may want to benchmark to Medicare, and do such, those types of things. And then, of course, you'll see down here at the bottom of this pair dashboard, and we're going to talk about denials in just a minute. But this metric right here, days to first insurance payment, this is one area, again, that is often overlooked when organizations often are limited to understand exactly how long is it taking to get paid. So let's break that down. When we think about the lag days, from the time a claim is actually dropped, right? There's a number of different days that go on where we've done the service, we've technically earned the money, but if we have a fairly long lag process between from when we charge it to when we bill it to when it gets adjudicated to when the insurance company actually pays, and then if there's any patient due or deductible. And so if we can clearly measure the KPIs in our lag and shorten that lag, we can very see a fair amount of money fall to the bottom line.
Yeah, the way I like to think about it, Russell, is if we can shorten any one of these lags by one day, we'll collect 366 days worth of payments this year rather than 365. It's a huge cash flow issue, and just bringing more cash to where we can actually spend it rather than cash that's tied up in the system.
Yep. And so, appropriately too, the other key area, probably the largest area where you can improve performance, is focusing in on denials. An average claim denial rates run 15 to 20%. Yet one of the statistics that, we've talked about and we read, I don't know if this one is completely accurate, but a lot of denials are never appealed. So that money's just lost. Right. So how do we use data, and how do we improve performance with our data? What are sort of the key metrics that we would want to see with denials, and how do we use them to improve performance?
Yeah, it's interesting because you talk about it where you say, we want to improve our reimbursement rates. We need to improve our contracts. But if you can improve your denial rates, you're improving your reimbursement rates, and especially if you're focusing on things that you can control internally. So really that's where we want to start. What are the things that we're doing in order to get denial? So that can be things like we have a lot of control over the registration process and the authorization process. We have a lot of control over the coding process and making sure that we're being accurate in those areas. And then, of course, we may have, a little bit more control over how much documentation we're submitting so that we're making sure that we're getting things out appropriately and not having to deal with denials on the back end. But it's not even just about denials and reducing the volumes. What we want to do is we want to prevent where we can, but then we want to recover when we can't. And so we need to focus our areas on recovery efforts and what are we getting when we do appeal these. Are there certain codes that we're never getting paid for when we appeal? And are there certain codes that we get paid for quite frequently when we appeal? And we need to put our resources into those.
Yeah. And, this is a great example of having good data where we're measuring that, recovery rate. Like you said, Scott, if we can understand where we're having trouble, what areas, whether it's, maybe it's registrations in certain locations, but being able to then analyze and understand, if we're never recovering on certain procedures from a payer, one question is, why are we chasing those denials? Or two, how do we then go about fixing our process or working with the payer to make sure we are getting paid for the work we're doing? Let's talk about some of the ancillary services and some of the other key areas that are, significant to both the patient experience, our operations, and ultimately the financial bottom line. Scott?
Yeah, so it's not just the financial piece that we're getting from our surgeries, but we may also get reimbursed for if we're providing the anesthesia services or if we're providing doing the radiology reads and services as well, that how we're getting reimbursed on those. It's really important to understand if we're working with durable medical equipment, things like that. All of these really tie into our overall financial performance. And of course, you really can't discount PT. And looking at PT is more than just a financial issue. This is something that actually leads into quality as well.
Let's talk about the fourth cornerstone, which is our clinical and quality area, where we're certainly going to look at things like surgical outcomes, length of stay, readmission rates. We're also going to talk about the various payer quality metrics, and if we have any other specialized services that might fall into our ability to differentiate our practice or show we're a leader in how we're performing and providing the best outcomes for our patients.
Yeah, and clinical is one that may be a little bit difficult because it's tough to quantify. There aren't a lot of measures out there that we're looking at. And so a really good place to start is where there have been metrics already defined by a third party. And so look at things like MIPS and understanding, looking at MIPS metrics by gain of function for, specific subspecialties that we're treating, whether it's, knee or lower back or hand, wrist, etc. Looking at those gain of function scores that are coming across with the with MIPS. In addition to that, we may want to look, at individual providers and how they're tracking with these individual MIPS scores that are out there as well.
Yeah, and what I'd call a static dashboard versus the visual ones that we've been using here. This is an interesting chart on the bottom here because instead of sort of pointing out all the physicians, I want you to notice that the physicians that are performing are just showing up as the little dots within their passing scores for our quality metrics. But the physicians that are below the line and have the most need for improvement are the ones that we're seeing. And so we're trying to make it easy to visualize where we may want to focus to improve our quality or our MIPS scores. And of course, as I touched on, we have things like readmission rate. And again, trying to make sure that we're tying back to that all important patient experience. As much as we want to make sure we're doing the right things from a quality side, we also want to make sure that we're ensuring the patients are happy with the performance and the service and the medicine that they're getting.
Yeah, and of course, there's really no way to achieve that without having strong, engaged employees. And so that brings us to the fifth cornerstone where we talk about our staffing. And it's not just the providers that we're talking about here, but we're also talking about our front desk staff. We're talking about our nurses and our MAs, really making sure everyone is engaged. And then talking about, what we need to measure with regard to that, whether we're talking about turnover, recruitment costs, additional training, and of course, looking at referral patterns. While referring physicians aren't necessarily employees, they're definitely people that we need to make sure are engaged with our practice as well.
So there have been a number of interesting studies around employee engagement that lead to, ensuring that employees are engaged have a direct correlation to the patient experience.
Yeah, what we found is that the patient experience increases as we improve employee engagement. I think the numbers that we saw that said for every percentage point of employee engagement that increases, you receive a half a point greater patient experience scores. And so really looking at, how our employees are engaged is something that makes them happier at work, makes them treat the patients better, makes them have bring an overall more positive experience within the clinic itself.
Yeah, and with the, COVID and after COVID, I think there's been much more focus on measuring employee engagement and also, sort of ensuring and finding unique ways to, drive, employees, satisfaction and education and trying to keep them engaged. And certainly, I know from my own experience when you come in and the staff member is both enthusiastic and encouraging about whatever it is you're coming in for, it certainly makes you feel better about being there as a patient.
Yeah, especially in a surgical practice.
Yeah. So let's talk about some of those key staffing metrics. What are some of the other ways that we might measure employee engagement, Scott?
Yeah, I mean, we can have employee engagement surveys that are out there that give us an understanding of, how satisfied our employees are working for us. But one of the key ways to look at how engaged we are is look at turnover rates. You may have high satisfaction scores, but if your employees are leaving, that really drives up your cost from a recruitment standpoint, from a training standpoint. In addition to that, the constant turnover can drive down patient satisfaction as you have people who don't necessarily know what they're doing as well. In addition to that, we may want to look at various other metrics of costs for bringing new staff on. We might want to look at any various disciplinary actions that have been taken over the course of the year and trending those as well. So it's not just about the employee satisfaction scores, it's about looking at other key drivers, but behind it that may give us a more complete picture as to what's going on.
Yeah. And Scott, you mentioned, although they're not employees, to me, one of your key customers that we want to make sure we understand what's going on there is those referring physicians, right? And so we may not be able to measure the satisfaction of the referring physician, but we can certainly look at whether it's charges or patients referred and start to understand, which specialties or which physicians are referring patients and, potentially into what areas are they referring them. So, having good data, being able to understand referral trends. One of the things that I know several practices often look at it is who are the top referring physicians, and they're looking for drops. Did that physician or did that practice stop referring patient to us for some reason? And oftentimes the number one reason is patient access or patient satisfaction, where the patients weren't happy with the experience. So, really key to keep an eye on who are those customers. Ultimately, what we're talking about here is using software, using these tools. We just looked at a visualization to get to the data and make it effective so you can understand what's going on. And we've sort of shown some visualizations and some dashboards. What we haven't shown you is the ability for a user to be able to slice and dice through data or drill down to detail or just report at the patient detailed level. Why is that so critical? Well, with today, there's so many different visualization tools out there, but what is often missed is what do we do beyond the visualization? We want to be able to understand what's going on. But tools like Power BI, Tableau, Click have gotten very powerful. And some of the big reasons why organizations are using visualization tools is it just makes it so easy to understand the data, to understand where are their performance gaps. And a lot of that can be done if we build our dashboard to tell a story. Critical to that, though, and that's what we're talking about today, is having the right metrics and the right presentation so we can help understand and uncover those insights. So let's take a minute now and look at a visualization that ties together everything we've said.
Yeah, these visualization tools are really key right now to being able to distribute reports and high level data to a broad audience where you can look at this data and digest it very quickly. This is a good report that shows a lot of different metrics ranging from work RVUs to certain scheduling metrics like schedule utilization, also looking at patient satisfaction, charge lag, coding, etc. So all of this information is just kind of blended together to give a good overall perspective of what's going on with the practice and individual providers. But sometimes we need more. Sometimes these visualizations lead to more questions than they answer themselves, and so we need to be able to get in and better understand the data by maybe uh, drilling into the slice and dice capabilities that a lot of these tools have.
And so you can see I've now drilled from the visual dashboard into what is our cube, where I can do slice and dice analysis. I can start to filter through data, looking at things like our payer categories. I can, scroll down and filter into or pick a particular provider. I can nest columns. I can add columns. So this is that slice and dice capability, that makes it easy then to work with the data, understand what's going on. And if I then want to, I can just drill right into that level of detail. And so when I click and I drill, I can now start to see, who are the actual patients. I drilled in through on Blue Shield and I asked for all the services that were done in the office there. And so then I can even get down and start working with that patient level detail. Ultimately, what we have is we have the ability to work with patient level detail or sort of traditional reports. We can work with cubes, and we also then have that visual dashboard. It's what we call the trio of analytics, where we have the ability to move between the different levels of data, understanding, what's going on and making it easy for users to have the information they need. We're no longer struggling with, oh, I have to go run another query. And as we talk about physician productivity reporting, it's key that we've really got to touch on physician compensation, because oftentimes organizations say, well, I produce a bunch of productivity reports. Oh, and then once a quarter, we do something for compensation. We can't think about them as two different areas. Our analytics and providing data driven insights has to be able to help the organization see how is their comp tied into their productivity, and how do all of these different metrics tie together to make sure that our comp plans are supporting and cohesive to the organization and the organizational goals?
The key is really putting information into the hands of the providers and giving them consistent dashboards that they're used to looking at, giving them financial metrics like their charges, payments, and adjustments, and then things that are in their control that would impact those, like charge lags and coding curves. And then, of course, we want to revolve everything around patient satisfaction as well. But that's a good place to start, and then that can lead into being able to provide them with compensation metrics.
Yeah, and so you can see in this dashboard on the left side, we've got, what is the revenue that's been generated? How does that calculate into their comp, less any draw or bonus, and ultimately what's due for this comp reporting period? But I want you to notice, two things. This dashboard providing visualization is showing physicians trends in revenue. It's showing that important charge lag. It's showing even the physician related denials. So we're now starting to blend different data sets. But again, the physician productivity reporting, the physician comp reporting need to go hand in hand. We can't think about them in silos.
And this is one thing that can be a real physician satisfier, is because when you look at something like this and provide them with the supporting metrics behind it, it gives them the ability to self-manage, so that they feel like they have more of a hand in determining what their compensation truly is going to be.
So let's talk for a minute about leveraging analytics to improve performance, because we've talked about the 5 different cornerstones that'll strengthen our orthopedic practice. We've talked about some of the different technology, the visualization tools, and the importance of having a cohesive set of enterprise reporting in the organization. Ultimately, though, we've looked at summarizing data, trending data. We started to then benchmark data. And benchmarks are critical if we're going to use the analytics and project performance improvements or ROI, or as you've seen in just the last couple examples, the different relationships between patient experience, scheduling data, and financial and clinical data. So let's talk just for a minute about the importance of benchmarks.
Yeah, we have a lot of clients that want to do benchmarking, and a lot of times we don't know where to get the benchmarks, or the benchmarks are a little bit different than what we have, or things like that. Benchmarking can be a little bit difficult, but really the importance of benchmarking is to add context. You know, when we start with a new client and we start presenting these data points to them, and they say, you know, is this good? You know, it's really, we want the context to understand how well are we performing, and whether we're comparing to ourselves of, you know, where should we be? Well, we should be better than we were a year ago, better than we were a month ago, or looking at internal benchmarks where we can compare our own providers against each other, looking at departmental budgets, things like that, looking at these internal benchmarks of how well we're meeting these goals, and just applying context to these metrics. When we want to become a better, more high-performing organization, though, that's when we want to bring in these external benchmarks. And some of the sources of these are, you know, available there, whether you're using the AAOE or HFMA or MGMA, or even, you know, if you're an academic group using the Faculty Practice Solutions Center. There are good external benchmarks that are out there that you can find to apply to really start to bring your performance up to the highest levels.
Yeah. So let's talk about then. We're using benchmarks, we're measuring against benchmarks, but let's talk about what we call performance opportunity. And so we want to try to understand, where do we have our top performers, where do we have our middle performers, and what do we have our bottom performers? And it doesn't matter what metrics we're looking at. What we're trying to do is understand if we can move those bottom performers or the middle performers up towards where the top performers are, we can gain performance improvement. And it doesn't matter whether we're looking at patients per session, revenue per patient, surgical utilization, contracts, charge lag. It really doesn't matter what we're measuring. Ultimately, we're looking at those bottom performers and we're trying to improve. How do we take that bottom 20% and move them up?
Yeah, and this is really a great way to apply benchmarks rather than doing it in sort of a punitive or embarrassing fashion. What you're doing is you're presenting it as an opportunity, because every single one of those has a financial opportunity that comes through improvement. So when we look at these performers that are out there, we can say, you know, if you come up to this level, it would increase the revenue that you're bringing in by X amount. You know, and of course, when you're looking at internal averages, that's going to be a constantly moving target. And so there's always going to be opportunities to improve that are out there. And really, you can go in and you can look and you can say, hey, by moving up to this level that we want you to get to, you can increase your revenue by 40, 50, $60,000 in a given year.
Yeah. It's very hard to argue with the fact that we have top performers in our organization. You're below the average. If we can move you up, we can quantify that cost. And that to me is really using data to drive insights, whether it's financial performance, whether it's patient experience, whether it's, you know, scheduling utilization. If we could better utilize your time, you're going to see more patients. We can quantify the impact on more patient visits or the revenue per patient. Ultimately, what we're talking about here is empowering users with data insights, using these visualization tools, this cube report technology, to enable users to have access to the data we need. And we've talked about a number of the different key cornerstone areas, but I like this visualization, Scott, and we've talked to it several times. But walk us through, how do we think about all this? Because we've got this patient experience, the operations, the money. How do we think about blending them all together?
Yeah, I mean, it's one thing we talked about, you know, obviously patient satisfaction. We talked about operational issues. We talked about productivity issues and financial issues that come across. We need to look at these, and this can be very overwhelming and difficult for practice managers to say, how do I manage to all of this? There's so much just sitting right there. But the fact of the matter is, we're not managing to all of this. What we're managing to is a lot of overlap. We're not trying to look at three different solos. We're trying to look at this as a whole. And so if we blend this together and find out where that is, where that overlap exists, one of the things we're going to find right away is if we put the patient in the center. If we work around that, all of this other stuff's going to come into play. Focus on patient satisfaction, focus around the things that drive that. And then once you do that, you're going to have your patient access in order to do that. You're going to find greater opportunities for productivity and revenue growth when we know that we're treating our patients the right way and that they're satisfied with the care that they're receiving.
So we've talked about a number of different areas. We've talked about what is the strategy to use data insights to improve your orthopedic practice. And I want to challenge each of you right now today to think about this. I appreciate you joining us through this journey of data metrics, but I challenge you, does your current analytics strategy deliver the necessary data you need? Do you have access to metrics? Do you have access to the right metrics? Do you have access to dashboards that don't only allow you to visualize data, but to slice and dice and drill down to detail where you don't have to go back and say, run me another query, or we published information for a physician, but they don't understand why those numbers are the way they are. Number one, do we have that?
Number two, we need to understand what does management have. Management has to have constant access to the data. They need to be able to make informed decisions. We don't want them just firing off of their perceptions. We want them to do work off of what the data is actually telling them. And of course, we want to be able to provide consistent reports to them showing areas of performance gaps. What do they need to focus their efforts on so that they can find this continuous improvement?
Another area I challenge you, do you have the performance understanding? Do you understand where there are gaps in performance that are impacting revenue, quality, or the patient experience? Do your support teams, do your care teams, do the people at front desk understand the impact of, poor registration on your cash flow or on your denial rates? Right. And ultimately, even performance understanding, the physicians have in their compensation reporting information that both drives their performance, but also are our compensation plans in alignment with our payer contracts? And does our analytics and our reporting tell a single story to the organization about how we want to perform? And is it all in alignment?
Right. And if we're going to utilize data in our decision-making and management process that's out there, we don't want to spend more time getting the data than we spend working with the data. So we need to have automated processes to do that. We need to have automated reports that are sent out on a monthly or daily basis to get us the information that we need, that we can digest the data and move towards taking action on those metrics rather than spending time waiting for queries to run.
So we've talked about these key cornerstones to orthopedic performance. Of course, we could have probably talked about, 20 other things today, but in the interest of time, I do want to challenge you. If you answered no to any of those questions on the last page, I want you to think about considering PDS. We are experienced in delivering data, helping organizations in a variety of different areas. This is what we do. Just like you'd go see a specialist when you have a problem with your knee, when you have a problem with data or analytics, we encourage you to call PDS or engage us. We have solutions that can sometimes be very focused, just helping you get access to better data. In other cases, it may be helping you with your overall analytics strategy or your visualization strategy. But we'd love to hear from you if you feel we might be able to help you in your journey to improve your analytics and to use data to create insights to drive a stronger and better practice and performance that is both engaging to the patients and the employees. And thank you for joining us today so much. Appreciate it. And please feel free to reach out to us if you have questions, or reach out to us via our website for more information about our various solutions to improve your analytics in your organization.
Thanks for being here with us today, everybody.
At this point, we'll take any questions you may want to chat in using the Q&A button in the webinar toolbar, and we'll be happy to stay online and answer as many questions as we can. So please feel free to chat in your questions. We'd be happy to answer them at any time.